It is my pleasure to introduce our panel of distinguished guests that will discuss two of the crises in our community, both housing and childcare. And if you think we're the only community going through those challenges, you're totally wrong, because it's nationwide. That's a very recurring theme. So for this morning's discussion, our panelists are Becky Beaton, the Executive Director of 100 Nights. Becky. Right next to me over here, Chris Coates, Cheshire County Administrator. Morning, Chris. Alicia Deaver, the Executive Director of Rise for Baby and Family. Tom Julius, the Chair for the Monadnock Interfaith Project. Morning, Tom. We were supposed to have with us today Dan Smith, the CEO of the Keene Y. Unfortunately, he couldn't make it today, but he wished he could, so we will go by. And we get the benefit of having the moderator be our very own Liz Rose, the Executive Director of MUW. So let's get it started.
Hello, everybody. It is so wonderful to see such a full room here today. Thank you all for taking time out of your morning to come and spend time with us. We really appreciate you being here, and thank you so much to our panelists. We're also glad to have you here, and our GCCs. Thank you. So we've set up a topic today which might not seem like they go together. Childcare and housing, how are those intertwined? We're going to paint a picture today of how they are intertwined in our community. And so before turning to the panelists, I would love to set the stage with a math equation. So those here who are into math, here we go.
Wait, can I just say one thing?
Yes?
Ben, aren't you in banking? But you're not a mathematician, and that worries me a little bit.
Chris, business development.
All right, okay.
Okay, so Ben will not be taking out his pencil right now to do this math equation for us. Okay, so I will need the help of folks here who are good at math, because we are going to add. The median monthly income of a renter in 2023 was $3,600. It's the first number. We're going to subtract from that what the cost is of a two-bedroom rental. That's $1,441 a month. Okay, now we're going to do one more subtraction. We are going to subtract the amount of child care for only one child, and that is $1,166. I can see some people doing their math. This is wonderful. Okay, what's left over?
Not much.
Agreed. Do I have any numbers from the...
1,044.
I had 993. And I see a couple more math people. And my math is not good, so I need to make sure we're fact-checked. Okay, so $993 is what a family would have left after those two major expenses to cover everything else. What do you think they're covering? What else do they have to cover every month? Food? What was that? Electricity. Mm-hmm.
Meds.
Yes. Okay, you caught. Ooh, what was that?
Insurance.
Thank you. Okay, $993. So, for more context, in general, these are averages. Food per month costs $360. A car is, I've seen, from $120 up to $300 for transportation. Healthcare is just under $800. So we're in the negative now. So these are the ways that these two very important issues affect families, and they can deplete a household budget and put folks into a state that we would not like them to be in. Nobody wants to live like that. So we'll talk today now. I'm going to turn to our panelists. We'll talk first about housing, and then we're going to move into childcare and tie it all together. So our first panelist is Tom Julius. Tom, could you set the stage for us and talk a little bit on the housing side, what our community, our general community here, is doing to make housing more affordable for everyone.
Thank you, Liz, and thank you for all the really good work that the Monadnock United Way does. What I want to emphasize is that the United Way does two things, many more than two things, but especially two things really well. Focused funding for direct services and collaborating for systems change. The United Way has played a key role in organizing a new innovative group for this region focused on housing called the Monadnock Resource Alliance. Now, this is really exciting because it's a collaborative effort with the New Hampshire Community Loan Fund, bringing together people from all sectors, nonprofits, business, government, economic development, and faith communities. What the Resource Alliance did is this. They looked at the problems in our community and identified lack of housing as having really far-reaching effects, just like Liz just talked about. Housing instability strains families, affecting individuals as well as the community's well-being, right? So we'll be hearing from Becky about people who are unsheltered and Alicia about childcare needs specifically. But when people can't afford housing and childcare, this impacts our entire community. Employers can't hire people into the region. Our businesses and services suffer. Our hospitals, fire, police, and schools can't hire staff. Our community wellness suffers. And the story of Amber's family that Sarah told illustrates how an unexpected event can spin into a crisis and put people out on the street. The United Way and the Community Loan Fund brought government, nonprofit, business stakeholders together in this Monadnock Resource Alliance. They formed work groups, talked to people knowledgeable about the housing challenge, analyzed information, and the Alliance is moving forward with strategic systems change approaches, like a regional housing development fund, shared housing programs, important public conversations, and support for local town planning boards. Now, the Alliance is inspiring the community to be active and forward-thinking and to expand housing at all levels, especially for low to moderate income households. So, I hope you'll go away with is that the United Way is actually taking two steps, both necessary to making more good things happen. It's a two-step process. One step is funding direct service. That's something the United Way is really well known for. Essential support for food programs, clothing drives, shelter for those experiencing homelessness, crisis response, child and elder care. These are important, essential direct services. The other step is new, innovative change work, identifying the factors that make those social services necessary and collectively pursuing innovative strategies and creating new community systems. That is what the United Way is doing through the Monadnock Resource Alliance. Two steps: direct service, systems change. And both are needed to move us down the path to making more good things happen in this community.
Thank you, Tom. And accolades to you, Tom, as well. Tom has been a member of the Monadnock Resource Alliance since we started probably 3+ years ago. And we formed into a group that is now has our work groups, and that really launched with your help. You were highly involved in that. back in the end of 2023. You are leading one of the work groups, and that's the soft infrastructure work group that is reaching out to those planning boards and really creating community. So thank you, because really you've talked a lot about United Way, but it's all the volunteers that are doing the work and meeting every month and making it happen. So thank you for that. We'll turn now to Becky Beaton, who is the Executive Director of 100 Nights. And Becky, you're serving people who are experiencing homelessness or who are experiencing housing insecurity. Can you talk for folks and paint a picture of what the issues are that you're seeing for the people that you serve?
Of course. So as Tom touched on, housing is an issue, and lack of affordable housing, lack of housing in general just exacerbates the issue and is probably the number one reason that we're seeing homelessness increase. But you don't become homeless just because there isn't a house. There's always something else underlying it. We see individuals with mental health issues, and we see individuals with substance use. And something, the story that was told, it only takes one thing. And I would ask every single person in this room to just think of one situation in your life that if you didn't have a great support system, you would be in that same situation. And think about that before anything else. Before you start making judgment calls, just say, if I didn't have this. So what we're doing through the United Way is actually a collaborative, the Cheshire County Emergency Housing Collaborative. We're working with Southwestern Community Services and the Monadnock Center for Violence Prevention. We're working together to address the shelter needs. And while we all do it a little bit differently, working together helps us be more efficient. It helps us come up with community resources, community solutions, and we're sharing wins with each other. We're sharing questions with each other, and that's really what the collaborative is all about, and what the United Way is helping us do. So we can't do what we do every day in a silo. We all need to be working together. There's so many pieces of the way it comes together. So with the MRA helping us get those housing units, with the other shelters working on the way that they do projects, and we work together with all of the other nonprofits. We're even talking about, childcare. That's a huge expense. You have to make choices when you're at this level of income. And if you have to choose between your house, your food, your car, your kids, that's a big ask to choose between all of those things that we see as, necessities or take complete, we have them and we don't even think about it. So that's what we're doing as a collaborative. That's and why we should be working as a community to really make sure we're reaching all of those needs for everybody that's here. Because if everybody's doing better, the whole community is doing better. So that's one of the biggest things. I'm a huge proponent of how we're working together.
Thank you, Becky. And Becky is a new executive director at the 100 Nights, so thank you for stepping into that role and stepping in so quickly, just since April, I think. Yeah, already making a huge difference. We really appreciate it. And I just want to put a fine point, too. One of the things that the collaborative that you're being funded on, so that's the funding side that Tom was referring to, those three agencies, when they've reported back to us this past year, have said, well, we're actually serving less people in our homeless shelters and in the other shelters, and it's not because there are less people needing it. It is because they can't move from the shelters into a place that is affordable and safe and appropriate. And so that's also where when you think about housing, you're thinking about housing at all levels. Because the more we have here and here and here and here, we can start pushing people out and back into the world where we would like to see them, right? Thank you.
And one of the concerns with that, of course, is if we aren't able to help people move on and more individuals are becoming homeless, you're going to see more unsheltered individuals, and that's just not a good situation for anybody.
So we're going to address that now before it gets any worse. Thank you. So we're going to turn to Childcare and Alicia. Talk a little bit about how we actually got here into the childcare crisis. I think people here who have children or grandchildren, you probably know and have experienced what that's like. But for those who haven't experienced it, can you let us know how we got here?
Yep, and before I go there, I do want to make the connection that many of you may be thinking, well, families who are lower income would have access to childcare assistance and would have, some of those resources available to them. And in January, there was a recent hike in the childcare assistance reimbursement rates by the state, which are very helpful. But even for families with low income, especially if they have multiple children, it doesn't cover the full costs of the weekly tuition. And so it's really a huge thing in partnering with Monadnock United Way for this because of their childcare scholarships, which benefit so many childcare programs, and the work that they're doing because it helps to close that gap. For that. So we definitely got to the childcare crisis. It was always present, but the pandemic exacerbated it. And it happened because of caregiver burnout. It happened because of caregivers needing to stay home to be with their children while their spouses remote worked or had to go into the office, kind of depending on how that went. It happened because of low wages. So on average, a child care provider makes anywhere from $9 to $15 an hour. There's many programs that have increased because they've had to be able to compete with the grocery stores around here and other manufacturing entities. So a lot of people left the field because it's very stressful to work with young children. And it takes a lot of energy to put the well-being of these tiny littles, ahead of your own needs. And so if you're making very little pay, if you have no benefits, and then there's just very little resources. So we lost a lot of our field. So that's left us to our current situation where we are overall amongst the centers, we are able to get the 18 to 24-year-old crowd, which is great. We have these young, eager individuals who are ready to learn and ready to work. I know multiple centers who had individuals accept job offers who they were moving into the region. And these were individuals with associates and bachelor's degrees and many years of experience, and then upon not being able to find housing, ultimately declined and moved out into another part of the state or a different state entirely. So we're losing our employees due to the housing crisis. And then, so switching back to the 18 to 24-year-old crowd, Monadnock United Way has been pivotal in their collaboration with Keene State College and Keene Family YMCA in securing that $1 million grant from Senator Shaheen's office, which has helped us to educate that younger crowd. So we've been able to pay for the child development associates for these staff. So that is a national credential that comes with 120 hours of training, and it comes with observation and a test. So it's something that you would get, between kind of high school and an associate's level degree to prove that you have taken your education further and gained new skills and capacities. And per state licensing, if you obtain your CDA, then you're able to be a lead teacher. So this has helped us to be more stable as a childcare throughout the region. It's helped us to raise the quality of our programming, which helps us to get other statewide incentives and supports. So it's all really, really integral. And so when we look at Keene Family YMCA Childcare, they had 7 individuals obtain their CDA in this past year through this work. And that has meant that if everybody saw the article in the Sentinel, they've been able to open new rooms and offer more spaces and more slots. And that's ultimately what we're aiming for and what we're trying to do is make childcare more accessible for families. And so there was 2 things that I wanted to share too, is just that, when we're looking at this comprehensively, going back to the cost of childcare, At Rise, we have a family where we've had older children before come through our childcare, receive early intervention services, have multiple services. And this is a family where we have worked to provide scholarship for them in the past. And we came back with the new rates. Everything was going great. $20 a week copay doesn't seem like too much. And multiple times in the past 2 months, the auto draft has bounced for this family. And it's not because this family is making poor financial decisions. It's because groceries are exponentially expensive, all the things that were listed previously. So as a nonprofit dedicated to family well-being, we're going to figure it out. We're going to waive the copay. We're going to keep the child in care, because ultimately that means that parent can still work, that parent is providing for their family, and the workforce is not negatively impacted. But what about when it's a $75, $80 copay and the child care program can't, afford that? And ultimately that child gets dismissed, and then the child's on the wait list for 7, 8, 9 months for a new child care program. So that's why the work the United Way is doing is so critical, because it's preventing those types of situations. And then one last thing, sorry. So circling back to Amber and that story, so that's a classic example of a family that the Monadnock Alliance for Families, that is fully funded and supported by Monadnock United Way, would greatly benefit from. So the Monadnock Alliance for Families is Monadnock Family Services, Rise for Baby and Family, and the 3 resource centers and family resource centers in our area. So the Grapevine Family and Community Resource Center, the River Center in Peterborough, and Healthy Starts at HCS. And so when we look at that, this family may come into the Grapevine for the play group, but then they may also be referred to early intervention services through RISE to help with the development of the baby, especially if there's prematurity. And in there, we may refer to Monadnock Family Services for helping the family to grieve. We may connect them with Healthy Starts at HCS so that they're helping to connect them to filling out the applications for child care assistance and getting that family access to those resources. So that collaboration too is another way that Monadnock United Way is helping to help support with helping families to get access to what are the resources for housing, what are the resources for childcare. So.
Thank you, and
Yeah.
thank you for all you and the group do. Yeah. I have a couple stories, so I'm going to just pick one. But I love the fact that the Monadnock Alliance for Families, just like any of the other funded collaboratives that we're working with, when they get together, they're trying to figure out how to do more together. And so the collaborative that Alicia is talking about literally said, okay, how do we make those referrals, and not just a phone call, but actually have similar processes to do them so that it's the same kind of intake form, we know who to call, we have a formal process, it goes smoother and faster. And it's just so wonderful to watch how a group can do that and break down a lot of barriers, because we know every one of our own businesses, we've got our way of doing this or our way of doing that. And to figure out how to make it across 5 different businesses similar, that's a big feat. So thank you for doing that on behalf of folks. And what you haven't also said is that they're serving many, many more families than when you first got together, like hundreds of more families. So
Yeah.
thank
At
you.
Rise alone, we had a 53% increase over last fiscal year in the number of families served. And thanks for Dan for not being here so I could have all his time.
Thank you. So to wrap up for us is the wonderful Chris Coates, who was a former, last year and the year before, general campaign chair. Chris, you grew up in this region. You are the county administrator. What are you seeing in relation to these 2 topics from a personal perspective and a county perspective?
Okay, so first and foremost, very privileged to be up here, you guys. I'm in awe of the work that you're doing, and I thank you for everything that you're doing, so thank you. So I want to start off, if it's all right, I stand. So a story. When at first time I really had an opportunity to understand what the Monadnock United Way was about, and I think it's great that team up that my mom was a teacher at Simon School for 29 years. And in the summer, she would tutor. And I remember the family, two individuals that would come to our house 3 days a week to get tutored by my mom for free. And they came from a house up by Robin Hood Park, and the house had, we'd actually go and pick them up, and we would then bring them back. The house was in shambles. It had black mold. It had windows that were broken. It had, you just think of the worst case scenario, it was. And I remember finally the mother asking if there was any way that my mom could help, because they trusted her. And they were very private people, but they knew they were struggling. And she turned to Kathy Snow, which was the executive director of United Way some years ago. And they teamed up, and they worked to find a home. They worked to find clothing. They worked to ensure that they had food. That is the United Way, all right? Coming together. We are very fortunate to have the United Way in our community. They do things on a level that if we didn't have them, we'd be in full crisis. I say this all the time, and I know some of you have heard me, but we're constantly at a crossroads, and we have paths to choose. And if we didn't have the United Way there, we'd be in full-blown crisis. Now, we've talked about childcare today. We've talked about housing today. We touched on food insecurity, but that's huge here. And a lot of times we think Keene-centric. And I'm a Keene kid, and I grew up here. But you know what? I'm also the county administrator. And isolation is huge in our community. It's when you talk about the money that you were talking about earlier, when they have to pay for their phones, because that's the only way they have communication, when they have to pay for gas to get into wherever they're working, that is happening throughout Cheshire County. And I'm proud to be partnered with the community kitchen so that we could do pop-up food pantries throughout Cheshire County. It's made a difference. They're seeing people they don't see at the community kitchen because they can go directly there. They can walk to where they're doing that. And we're hoping that we can continue that relationship. But at the same time, we need to continue to get that word out here, and to really develop that. And I want to talk a little bit about the ripple effect. And what do I mean by that? Well, when you talk about housing or you talk about childcare and people don't have that, they stay home or they leave. Nursing home. We had for 2 years almost a floor closed, that we couldn't find the staff. We had 6 staff leave. I went back and looked at records because every month I get a report on why people leave. And we had 6 people leave at one point, 4 of them because they couldn't find childcare. And the other 2 because they were moving to find housing they could afford. And that was one of the biggest issues why we had to close the floor, because if you don't have environmental aides, if you don't have LNAs, you don't have nurses, you can't. We have a ratio that we want to keep because we want to care for those in our care in a way that's appropriate. And so we had to close that down. What does that mean? It means our census goes from 150 down to 100. What does that mean? A hospital who needs beds for people coming in need to hold on to people longer because they have no place to move them. And what does that also mean? Your loved one may be going to someplace farther away for care. So what the United Way does on a daily basis is something that we need to do. We need to trumpet even louder than what we're doing. And we need to get more people involved to really start to understand that we're in a crisis here, and that we need to do whatever we possibly can to support these nonprofits and to ensure that they're doing the work that they're doing. So I guess I really didn't have I just wrote down real quick notes. What I would ask you is do a 2+. All right, go out and get 2 more people to get involved. Not just give, but involved. Because Cheshire, and let's start with New Hampshire. New Hampshire is in the top 3 of graying states. Cheshire County is in the top 2 of graying counties. So what does that mean to United Way? It means that people that used to give on a regular basis through their companies now have those people no longer in there, and they may not know how to give. Let's teach them how to give, that they can still give to the campaigns and through the United Way and other ways, and you can explain that much better than I can because I could never remember it when we used to talk about it on the radio. And so, do whatever we can to get out there. So next year, this room is even more filled with more people wanting to get out there and advocate for those, because it's too easy to do the other road and say these people are issues or problems, and to really stigmatize those individuals that are struggling in those moments. Let's change that course, and let's work together on that. And that's what I think the United Way does through all their work, through the coalitions. It's an amazing thing to see, and we need to continue to push that message out there. Thank you.
Thank you. Thank you, Chris, and thank you for being on the Monadnock Resource Alliance. Much appreciated. So I'm going to thank our panelists. Thank you so much.